What if a delicious meal on a holiday evening turns into agony and pain? Hello everyone, I'm Dr. Suresh Royappa, the specialist surgeon in Phoenix Hospital. With my specialist expertise in minimally invasive surgery, what we call as laparoscopic surgery and laser surgery, and of course our regular surgeries like thyroidectomy, hemorrhoidectomy, and excision of benign tumors. Today I'll be presenting to you a compelling case of a patient choking on a fishbone. This patient, a 53-year-old male, was referred to us from the internal medicine department with history of severe chest pain and dysphagia. So going through his history, I got the history that he had swallowed fishbone about 2 days back, which he didn't mind at that time. So with this history in mind, we investigated him with radiological investigation, that is CT scan, and the radiologist called up and said that there is a radio-opaque foreign body in the mid and lower esophagus with little air pocket in the mediastinum. So with this history in mind, we investigated him further with blood tests, and which were all normal. So with this one in mind, we decided to go with endoscopic retrieval of the foreign body, which is as minimal invasive as possible. We wanted to avoid a complex and major surgical approach of retrieving the foreign body. So we have gone for the minimal invasive approach of trying to retrieve the foreign body by the endoscopic method using a flexible endoscope. Actually, for removing a foreign body, we require what you call as a hard tube, which is put into the esophagus, called as a rigid endoscope, to remove. But with suspected history of esophageal injury, what we have done is we have used a flexible endoscope, the usual endoscope which we use for doing our ordinary endoscopy, upper GI endoscopy. The same endoscope we have used and with the endoscope guidance and with our biopsy forceps, we have with great expertise, we have removed the foreign body which was horizontal in the esophagus. Both the walls of the esophagus were injured by the sharp fishbone foreign body, which was around 30 centimeters from the upper esophagus. So there was minimal injury. There was also some pus in the esophagus, and with cleaning and everything, we have expertly removed the foreign body, which was about 4 centimeter thick fishbone, which was stuck into his esophagus. And also with endoscopic guidance, we have even placed in a Ryle's tube into his stomach to avoid future endoscopic stricture and for helping feeding the patient. So this procedure was done under general anesthesia, and in fact the procedure got over in actually 20 to 30 minutes. So by this flexible endoscope, we have avoided a major surgical procedure which can involve cutting your chest and also your abdomen, and that is a major procedure which can take about 4 to 5 hours for retrieving such a thing. So post-operatively, the patient has recovered very well. Procedure got over in 20 to 30 minutes. Patient is very fine now. He's on Ryle's tube feeds. His chest pain has immediately reduced, and patient is sitting as if nothing has happened to him. And post-operatively, we have started him on Ryle's tube feeds. About 6 hours later, he's doing well, and about 48 hours later, most probably the patient will be discharged, in fact on oral feeds. And consecutively, about 1 month or 2 months later, we will be doing another flexible endoscope to see what is the status of the esophageal injury, and then we can take further from there. For all complex medical and surgical assistance, especially minimally invasive surgeries like laser surgeries and laparoscopic minimally invasive surgeries, our experienced surgical team at Phoenix Hospitals is always willing to serve you.